Hi, welcome to the Washington Post special report on COVID-19. I'm Libby Casey, the Washington Post's anchor covering politics and accountability, and I'm joining you from my home in Washington. Today, we'll talk about the race for a vaccine and where that is at. We'll also look at the possible death of retail and a looming mental health crisis in this country. But first, as you can see, there are the latest headlines we're watching. Number one, President Trump is applauding the growing number of governors who are casting aside the federal health guidelines and choosing to reopen their states, even though those benchmarks are from President Trump's own administration. A second headline, the U.S. Treasury plans to borrow $3 trillion from April through June as enormous coronavirus costs are piling up. And low interest rates are making borrowing cheaper, but the new debt shows how much new spending is outpacing the country's falling revenue. And a draft government report projects COVID-19 cases will surge to about 200,000 per day by June 1st, and that's a staggering jump that would be accompanied by more than 3,000 deaths a day. We're going to talk more about that shortly with my colleague, William Wan. But first, Philip Rucker, our White House bureau chief. Phil, it's so good to see you, but you're sideways right now. So I'm wondering if you can turn
I'm sorry, I'm trying my best here.
You're doing great. We're all trying our best. You're doing great. So let's see if can you just turn your device. There we go. Okay, hold on. Let's see if we can get Phil here in action. We might have lost him, but we'll get him back in just a moment. This is the reality of everybody working from home and everyone trying to make the tech work as best as possible. And I'll tell you what, it sure makes me appreciate all of our video operators and tech people back at the Washington Post who are often helping us with all of this stuff. We're going to get Phil. There we go, Phil. You did it. Fantastic.
Okay, we'll have to do it up the vertical way. So
Thank you. Thank you. Thank you for being so accommodating. We really appreciate it.
Sure.
Phil Rucker, our White House bureau chief. Phil, the first thing I want to start with, because you were part of a team that did this fascinating look into just how President Trump and his team are looking at models and making their decisions. And I want to dig into that. But first, what is the message that President Trump wants to be conveying right now? What does he want the American public to focus on?
We've seen the message evolve, of course, over the last several weeks. And right now, the president wants everybody to feel like the economy is reopened, like we're on the path to economic revival, that it is safe in a lot of states to get out of your homes and go back to work. And he's really trumpeting that message despite evidence everywhere that shows that the coronavirus pandemic, that the spread of the virus itself is really not mitigated right now. In fact, the deaths are continuing to climb day after day. And while some states are reopening, like Georgia, like Texas, like Colorado, many others are staying closed. And even those states that are open, we're hearing from local officials, from public health officials in those states, that it's really not safe to fully resume normalcy yet. And in fact, a lot of people are staying home. Our own polling at the Washington Post is showing that many Americans are not comfortable with getting back to normal just yet.
So the White House is looking at modeling. The question is just what models they're looking at and whether the models are feeding decision-making or whether the decision-making is sort of creating the model to fit what you want to see. So first of all, why are models important? Like, why does the White House need to justify its decisions based on modeling?
Well, using modeling is the best way to use the actual data of the spread of this virus, of the number of cases in different communities and states, and the number of deaths to make decisions as national leaders, as state leaders. And so the White House has been looking at publicly available data, namely the model produced by the University of Washington that has charted the spread of this virus quite accurately over the last several months. However, we reported over the weekend in the Washington Post that the White House created its own model. One of the top economic advisors there, Kevin Hassett, built his own data analysis that projected a far rosier outcome in terms of deaths than the publicly available information. And that modeling was shared within the West Wing and helped build a lot of momentum around the decision to try to focus on the economy and focus on reopening. It's the kind of numbers and data that the president wanted to see with fewer death counts. The trouble is it was too good to be true, and it just doesn't match with the reality that we're seeing in terms of the deaths really continuing to climb all across this country.
So, you and your colleagues reported that a former senior administration official who was briefed on this data called the Kevin Hassett model a catastrophic miss. So, how out of
That's right.
line with other scientists and modelers' expectations is what the White House has been looking at?
Well, I wish, Libby, that we had the actual charts, the day by day charts that would show us in raw numbers what those models were projecting in terms of deaths. Of course, it's a model, so it changes every day based on new data that can come in. But our understanding, based on interviews with a number of senior administration officials who've seen these models, who've been briefed on the findings, is that they consistently showed fewer deaths than were actually occurring in real time, and consistently projected fewer deaths down the road than the projections that were made by the University of Washington and other modelers.
Phil, you and your team report in the story that it's based on interviews with 82 administration officials, outside advisors, and experts. Why was it important to talk to so many people?
We are proud that we talked to so many people for this story, and it was a team effort, by the way. Five of us reporting at the Post doing these interviews. And we thought it was important to get the full spectrum of information, to not just be limited to what the officials in the White House are saying, but to go deep into these agencies and learn what the experts there are saying and experiencing, to talk to the president's political advisors on the outside and see what they were hearing, talk to other people who've been influencing the decisions that are being made in the West Wing. And with all of those interviews, with all of that information, we can put together what we think holds up as the most thorough and truthful account of this 34-day period, from when the president decided in late March that he would be extending social distancing guidelines throughout the month of April to the period that we're at right now, where he's made this hard pivot to focus on the economy and is cheering on the reopening of a number of states on May 1st.
So President Trump has tweeted liberate and encouraged people who are protesting and upset with social distancing and stay-at-home measures in states to push back against those. But Phil, that's even as the Trump administration's own government gave an outline of steps that states should take in order to decide that it was time to start easing up on restrictions. What is the White House's acknowledgement of that contradiction?
It's interesting. It's so inconsistent, but it's not new, because we see a lot of inconsistencies all the time in terms of what the president is tweeting versus what his own government is doing. But in this case, he was encouraging those protest movements in states that are led by Democratic governors, even as his own task force, his coronavirus White House task force, was encouraging different guidelines. And it was very confusing to people who were seeing these tweets, but our reporting shows it was really just a reaction by the president watching cable television. He watches a lot of TV news, as we all know by now, and he was seeing these protests form. And as he watched the images of these protests, he saw his own campaign flags and he saw his own campaign paraphernalia, and started to consider these protesters his own people. These are Trump supporters. And so he wanted to find ways to show solidarity with them, even if they contradicted the instructions that his own government was issuing to the people.
What's the conversation at the White House about next steps? We'll all be looking, of course, at the data of states that are choosing to relax restrictions and open back up, Georgia, for one. Is there a concern that if we see rising cases, rising death tolls, that this could ultimately be terrible for the economy as well as for human lives, and ultimately for the president's political future?
Absolutely. It's incredibly risky what's happening in some of these states right now. These are all decisions that these governors and their state health officials are making themselves, absent presidential leadership. I mean, this is up to the states about whether to reopen. And a lot of them are willing to take this risk, the health risk. There may be a lag before we really have a full sense of the impact of the reopening on the death counts in places like Georgia and Texas and now Florida and Colorado, because it takes about 2 weeks for that data to really register. But that being said, if we were to see a new outbreak, say in Dallas, it would be hugely consequential in terms of showing that the decision by Governor Abbott was, opening too soon. And it could have a political cost, not only for him, but for the president as well. And it's something that White House advisors are paying very close attention to, according to our reporting.
Hmm. Let's talk about hydroxychloroquine, because those of us who've been
Yeah.
watching the briefing and people like you have been attending the briefing in person at times, we heard it talked about so much by President Trump as well as by Fox TV cable news hosts, and then it just sort of dropped away. So
Yeah.
your reporting digs into and goes into sort of why this is being talked about so much, where that push came from, and acknowledges that it wasn't the silver bullet that the White House was perhaps hoping it might be.
That's right. The president sees on hydroxychloroquine as a sort of a magical cure-all to the coronavirus. He was following coverage on Fox News Channel, promoting the drug heavily. He was getting calls from friends in New York, including Rudy Giuliani, the former mayor, and his personal attorney, who were really pushing the drug. He was even paid a visit by Laura Ingraham, the Fox News host and conservative commentator, who came to the Oval Office explicitly to pitch the president on this drug, on hydroxychloroquine. And then we heard him use his pulpit as the president to encourage people to take the drug, to encourage doctors to prescribe it, and to pressure the Food and Drug Administrator to commissioner to approve the drug for use as treatment with or to use hydroxychloroquine as a treatment for the coronavirus. And of course, fast forward a few weeks, we now learn that there are deadly side effects. The FDA has warned against prescribing this drug as a treatment for COVID-19 because it is not proven to work, and in fact has proven to result in some heart conditions that can be deadly to patients who take it. And so there's a real danger in what the president has been doing, which is promoting an unproven theory, but it stems from a motivation by him to have this magical cure-all. He wants to find a way out of this dark crisis for America and for the world, and is just grasping at whatever he can.
I'd like to welcome William Wan to the conversation, health and science correspondent. William, thank you so much for joining us. Phil, I want to ask you at this point, though, who is the president listening to, right? You give the example of Laura Ingraham visiting him at, visiting the White House, and the president consuming a lot of Fox News and getting information and ideas from that. But who has his ear right now besides those people?
It's a great question, and there's no easy answer. There never is an easy answer on this question, because there are people in positions of authority in the government who he should be listening to, who the sort of structures of our government would indicate are the key advisors, the chief of staff in the White House, for example. But Trump has such a different format and leadership style, and so he's actually listening a lot to people he reaches on the phone, friends in New York, friends at the Mar-a-Lago Club down in Florida. Political allies outside of the government, even cable television personalities like Laura Ingraham. So he's getting a diversity of voices, and it's not clear that although the scientists like Dr. Fauci have the president's ear, it's not clear that he's valuing their expertise and their guidance over, say, the medical expertise and guidance of Laura Ingraham.
William, we were talking about a model created by Kevin Hassett at the White House that was sort of painting a rosier picture than a lot of other models and other epidemiologists were projecting. I want to bring you into the conversation to talk about this draft government report that you were writing about yesterday that's projecting that we could see surges of about 200,000 cases a day by next month, and that could translate into 3,000 deaths a day. First of all, tell us, William, what do we know about that report and where it came from?
That report, the provenance is really weird and interesting in that I talked to the creator of the model who that report is based on. And it was this, it came from this FYI he sent to some officials at FEMA. I'm working on that model you told me to. This is how it's going. This is like the very rough preliminary 20% of the findings we have so far. And they took that and made a slide deck. And that's what kind of started circulating among officials and to the news media. And he was actually kind of appalled that it was out there in the form that it was. That said, he said, the numbers may be off. 200,000, according to some of these other models I'm looking at, is quite high. It's a really, really high estimate. But a drastic increase is not out of the question. Several other very credible models show that as well. And it's basically because of these reopening. It's kind of like very basic disease infection science is that the more transmission, the more contacts you have among people, the higher the infection rates are going to be.
We got a question written into us from Sarasota, Florida. Arrest wants to know, are the new predictions for an increase in deaths from a possible result of the state's easing social distancing and opening back up? So I'd like to hear from you first, William. It's tagging on what you were just talking about. As the models have been created, certainly they have to change and adjust as states open up. And we look at locales almost sort of running an experiment of sorts to see how they can stop transmission even as they get people back out at places of business.
It's a really good question. I think the framing of these debates has been a little bit like intellectually dishonest. It's always like, we need to open up and free our economy and save our economy, or we need to like keep everything locked down. And it's just not that way. There's two other levers, and those are testing and contact tracing / isolation. And without those, like, there is a way we could open up our economy and really start recovering, but it requires testing and contact tracing. And so the increases that are predicted, yes, they are directly a result of prediction. They're projecting what will happen as states like Texas, Florida, Georgia reopen. It doesn't have to be that way. If our federal government could get its act together, could ramp up production, could lead the way on manufacturing for tests and supplies, it could be a different picture.
Phil, what's the conversation like in the Trump administration about what we've heard folks like Dr. Fauci and Deborah Birx talk about, which is an organized and robust testing plan and then contact tracing plan? Where's that conversation at?
Part of that conversation is not happening at all. Certainly, the administration has been thinking a lot about testing for the last couple of months. In fact, in March, they were trying to put together a national testing plan that didn't really accomplish what the president said it would. And now the position has changed to try to put the onus on the states, to say states are responsible, governors are responsible for developing their own testing plans and acquiring their own testing supplies in order to conduct those plans accordingly. But on the issue of contact tracing, there is virtually no serious plan nationally for contact tracing that we can determine. It's our understanding that the White House staff, the key coronavirus players advising the president, are really not at this point prioritizing contact tracing, and the president certainly is not focused on it. In fact, you almost never hear him talk about that. And yet all the experts say it's necessary and really important to be able to get back to normal, to have businesses fully open, to have people working in office towers again, to be able to do contact tracing, to figure out exactly who has the coronavirus and then isolate them and isolate anybody else who might have been infected by them.
Phil, are there some within the White House who would like to see the president take a lead on trying to provide sort of the information that has come directly to him from his medical advisors and from the scientists within the government? You yourself tried to ask the president about that at a briefing, pointing out that people want information and guidance. They're not looking for a rumor. And the president didn't really answer. Instead, he just slammed you, Phil. So are there some in the White House who would also like to see that?
Yeah, I think certainly many in the White House would like to see the president take a different tone in these briefings and adjust his messaging to show some more empathy, to not spar with reporters as aggressively as he has. But in terms of spotlighting the scientific expertise of Dr. Fauci and Dr. Birx, there's actually been a deliberate strategy in the last week in the White House to put them on the back burner and to focus on economic issues, to have the Treasury Secretary, Steven Mnuchin, out front more prominently, to have the president talking about economic issues and thanking small businesses and so forth, instead of spotlighting the public health concerns, instead of having Dr. Birx and Dr. Fauci talk about all the deaths that are still to come or talk about all the best practices to avoid getting infected. That is seen inside the White House as pessimistic talk, and the president very much wants to be focusing on optimistic talk and people getting back to work.
All right, Philip Reicher, White House Bureau Chief. Thank you so much for joining us, Phil. My apologies.
Thank you, Libby.
At the beginning. We're so glad to.
No, I'm sorry, guys. I'm glad you stuck with me.
Yeah, we're so glad to see you. Stay with
Take
us. We're
care.
going to talk more about some of these models and just what they mean for the future, but we're also going to talk about the mental health crisis that's looming, and in fact has already arrived for many people. So stay with us.
These days, it's anything but business as usual. That's why working together is more important than ever. AT&T is committed to keeping you connected so you can keep your patients cared for, your customers served, your students inspired, and your employees closer than ever. Our network is resilient. Our people are strong. Our job is to keep your business connected. It's what we've always done. It's what we'll always do.
William Wan is my guest, health and science correspondent. William, before we change directions with our topic, I just want to get some final thoughts from you about this question of sort of modeling and looking at data. Um, this report set off a lot of alarm bells, even though it was like a draft report, because the numbers were so staggering. Even as we're hearing the president talk about success stories and his team encourage governors to open up the states. So, what questions does this draft report raise?
One key question is how far up the chain this report got and how receptive they are to it. Even if the numbers are wrong, the message of it is pretty consistent with other very credible models. It's that reopening without safeguards, without kind of a guiding strategy could lead to very rapid increases in infection and cases. And I guess that's the main question is there's this tendency we've seen from this White House where they only want to pick the rosiest models and rosiest projections and the most optimistic kind of messaging. And at some point, you have to kind of really look at the data and base your strategy on not what the best case scenario is, but like what, not even the worst case, what the kind of medium case scenario is and how you should kind of react. And I guess the last question is just these models, they can only predict so much, and they're based on these assumptions. And I think they generally have been good. They've been really helpful in many different ways. They've guided a lot of the decisions on the state levels by governors in the absence of federal leadership. What they could not predict, though, the one that kind of confounded all of them is human behavior and the just how crazy politics is in U.S. compared, even in worldwide comparatively. Like a lot of the experts, they were looking at the situation and they're seeing there's no way any state federal leader would see a place where infections are rising and suddenly end restrictions. No sane person would do that. And yet, you look at what's happening at Georgia and some of the other states. So that's where I think some of the modeling went wrong, is you just can't account for the craziness of human behavior.
And also, just governors who are trying to balance the economic
Yeah.
distress with the health risks and weighing some real consequences. As you've reported, many experts believe it can go hand in hand, right? Ramp up testing, get that contact tracing going, establish some sort of protocols, and that can help lead to reopening. But we're seeing a lot of people sort of treat it as an either health or the economy.
Yeah.
You wrote a really riveting story about mental health. And one of the concerns about mental health is the devastating health consequences people are fearing and facing, but also the devastating economic consequences, and how losing your job and going into debt or going bankrupt can be emotionally and psychologically devastating. So William, what are mental health experts warning about right now in this country?
Sure. I mean, the mental health thing is so important. And the economics, like these decisions governors are making, like the economics driving it is not just about money. It is about people at some level. And so there are some different studies based on what's happened after natural disasters, the data we know about that after 9/11, after the Great Recession, especially. There's a lot of studies done on that, and it shows that for example, for every 1 point increase in the unemployment rate, you see a 1.6% increase in the suicide rate. It's hard to draw direct causal relations, but there's a very strong link that's been shown in many studies. And so you have suicide, substance abuse is strongly linked to the economy. There's a concern about overdose deaths going up, and some projections that have already been released about that. And so there's also domestic violence and child abuse. And the domestic violence and child abuse especially is just, it's kind of heartrending. I was talking to some advocates who describe, everyone's sheltering in place. You can't get away from a situation, even if it's dangerous in a situation like that. With children, you have schools closed down. The first detection point for warning sign of child abuse is often teachers, cafeteria ladies, frontline people who can actually check in on the welfare of a child. So there's a lot of concern about that. But even just beyond those kind of very serious issues, there's just like the everyday people who, even if you didn't have a mental illness before, like it's very normal to feel like you're going crazy in a situation like this. I looked at some studies of solitary confinement when you lock someone up alone for even just a few days. There are short-term consequences and there are long-term consequences.
I want to recognize the complicated reality of talking about suicide, because you interviewed
Yeah.
some mental health professionals who said that they're wary about talking about suicide too much, because
Yeah.
it can sort of put ideas in people's heads and have them kind of ruminate and dwell on it. So I want to acknowledge that and recognize it, but still it's important for us to report on and go through your article about ways that you can try to like keep people safe. We're putting up the National Suicide Prevention Hotline right there. So how did you balance as a reporter reporting and acknowledging this potential danger while also respecting what mental health professionals want to do?
Right, and so there's very clear research that shows suicide can work as a contagion. The more you sensationalize it, the more you kind of expose people to like predictions of it, the more it can happen. But the key thing about it is not we shouldn't not talk about it. What we should do is talk about it in conjunction with things can be done. Suicide is not inevitable, so these numbers we were talking about, for example, the unemployment rate going up and suicide going up, if we as a society put in place, we had more resources for people, if we cared about mental illness the way we should. Um, Suicide is preventable by crisis text lines, suicide hotlines. It's preventable by therapy, by getting people help when they need it, and most importantly by screening. So there's this real push among advocates that the thing, just like we're talking about with the virus, testing, it's essential. With mental illness, with mental health, screening is absolutely essential. So there's talk of like, anytime you visit an ER, let's just do a universal screening for mental health, especially in a time like this. Whether you visit with a pediatrician, with a primary care doctor, let's do screening, let's do mental health screenings in those places. It could do so much for our country if we treated mental health as seriously as we did physical illness.
So is there a national plan to deal with this? Because so many mental health experts are warning of this moment having, particular peril and challenges.
There is unfortunately not a national plan. There's what's happening is that the experts I talked to describe almost like a shadow pandemic that's going to come in the coming weeks and months. And so you have the actual pandemic of the virus, and then weeks or months later following is this kind of much more subtle pandemic, but it's going to cause equal harms. And the problem with US especially is that we as a country, we've neglected the mental health system for decades. It's vastly underfunded. It's totally unprepared for something like this. Even in best of times, people had enormous difficulties like getting their insurance to pay for therapy, for just regular treatments to mental health. And so at a time like this, it's going to be, when it's even more crucial, it's going to be really tough. The one thing that is really critical is funding. I talked to some of these so you have the regular therapists you kind of see, sometimes you pay out of pocket, sometimes your insurance will cover it, and then you have these mental health clinics in communities that address the most at-risk groups, low income, minority groups, people on the fringes of society, homeless populations. Those centers, there's actually many centers that are actually facing, they're on the brink of collapse financially because the funding has dried up for the kind of services they used to do. So funding right now is key. And you had a whole coalition of groups asking for, I think it was 0.5 billion is what's needed to kind of salvage the safety net we have now. And in these last, Congress passed trillions of dollars. There was, I think, less than 1% of what these groups have asked for, which was already a very small amount. Less than 1% has been allocated to that. So we really need not just the White House, but Congress as a society, we need to take mental health into consideration on this pandemic.
There are specific concerns about frontline workers, especially those who are dealing with illness and death. So what did you learn in your reporting about that?
Yeah, the doctors and nurses, but beyond them, even grocery workers, delivery men, I think there's a lot of concern about a few things. PTSD from just the exposure of trauma. It's the risks that you're exposing yourself to, and then the decisions you have to be making. It causes a lot of stress. How am I going to keep my family safe? What in this certain interaction with a patient, with a delivery, is going to put me at risk? Just constantly thinking about that creates a kind of set of trauma in the mind and emotions. So there's that, and then there's kind of the cumulative effect of when these things are not addressed. So there's not that much. There's no, as you mentioned, no national plan for dealing with this. And so what happens over time is that trauma unaddressed, it kind of festers, magnifies, and we saw some of these. The concern kind of grew after, especially last week, after there was the top emergency doctor in New York who died from suicide, and then just a few days after that, a Bronx EMT with the same. And so I think the concern is, right now we're starting to see a little bit of it during this pause of doctors and nurses kind of reflecting of what they saw and the trauma of it, and you need to process that. You need some help with doing that. And the worry is, in the weeks to come, that trauma we're gonna see the effects of that, and we need to deal with it before that wave comes.
So there's this group consisting of more than 250 mental health organizations that are trying to create some sort of a national response. Now, not something led by the federal government, led by the White House, but they are coming together to do it anyway. And it does have the participation of one federal agency. What are they hoping to do?
They're hoping to, I think, a few fold. One is just raise the awareness. We're so focused on the virus right now, just to raise awareness that there's a mental health component to it. The other is, I think, just get with awareness, just get funding and buy-in. There's one federal agency, the National Institute for Mental Health, and they're so great. They're really, really good. But just alone, they can't really do that much. A lot of the funding to these community health, mental health clinics, it flows through SAMHSA. This is an agency that oversees substance abuse and mental health. Some of it has been put into providers, but that goes to hospitals. They need an interagency national kind of buy-in toward that. And I think that this coalition is the first step toward that, is trying to even raise the awareness to start talking about it.
William, you report on challenges that mental health professionals, therapists are facing, just trying to deal with sort of the bureaucratic red tape of trying to see a client through telemedicine. Maybe, you're someone who works in Maryland but lives in DC or something like that. So there's a lot of problem solving that folks are trying to do. Are there any silver linings at this moment? Are there any experts you talk to who think that this might open the door to more telemedicine or more ability to get mental health? And I want to just welcome Carolyn Johnson, who's joined us. It's so nice to see you, Carolyn. So William, is there hope that there can be some evolution and development through this?
There's a few silver linings. One, in talking to a few therapists and even some of these national leaders, there's some hope that, with everybody feeling this pressure and trauma now, that it makes it less shameful to kind of discuss it, to talk about it in society, to seek help. That's one huge silver lining that really could come out of this, is we have less stigma around mental health and mental issues. The other is, this is forcing everything online. So, therapy, treatment, everything's going towards telemedicine. And if we could figure out how to do that, that could really open up access. You no longer, you think about these rural areas with no therapists within 40 miles of a town. you could really open that up if we could figure out how to do this telemedicine and how to get rid of a lot of the red tape that's holding it back.
All right, William Wan, a science and health reporter. This reporting is so important, William. So thank you so much for taking the time to talk with us about all these stories. I read your byline with Carolyn's byline so often. You guys team up on a lot of important stories on the science and health beat. So it's great to see you both in person here together. And we'll say goodbye to William and Carolyn. The race for a vaccine, that is our topic with you. Where is this progress at? What are you watching in terms of the attempts to make progress on developing a vaccine?
Well, the race to make a vaccine has a lot of different parts, and the scientific community has been marveling at the speed because things are going faster than anyone has ever seen before or even really imagined, probably. But of course, people are impatient and there's a dire need to get one as soon as possible. So things are moving quickly. Just this week, Pfizer, a big pharmaceutical company, began a trial in Maryland and New York of its vaccine candidates, and there's 2 others that are kind of in human trials, which is that first really crucial step to figure out the dose that's optimal, figure out the safety. But it's going to be as Dr. Fauci has said, probably a year. I know they're trying to make it faster, but people are even skeptical about the 12 to 18 month timeline because it's just never been done before.
A headline that we're looking at, you reported on, the world came together for a virtual vaccine summit, but the U.S. was not there. So why did the U.S. Stay out of this?
The U.S. has applauded other countries for getting involved, and there's a lot of backstory to a lot of these international collaborations. Obviously, there are people very upset to see the U.S. not at the table, but there are it's hard to know what the effect is on the speed of developing a vaccine. I think where people are less sure is we're going to need a lot of international collaboration to deal with scaling it up and then figuring out who gets it, so that it doesn't just go to the wealthiest country or the country that happens to have the factory in it. And that's where you're going to really need these international agreements. Going to be delicate. People are going to be fighting probably, both within countries. Individual people will want access as well as country to country. So, it's something people are very concerned about, but we've never really seen anything like this before. So we're also just kind of watching multiple projects occur in parallel. And one positive thing of having a lot of people trying, because there are about 115 candidates that they know of right now, is that we need a couple of them probably to succeed in order to get enough vaccine. And so it's not necessarily counterproductive to have lots of efforts, but we do need to be thinking about cooperating and how we're going to work together as a global community to make enough and to make sure the right people get it first.
Carolyn, you told us about in your reporting a guy who lives in Washington State, who's 29 years old, who's participating in the attempt to create a vaccine. He's being willing to be like a test subject. What is this guy doing? What is the process? How does this work?
Well, usually when you start testing a vaccine, you test it first in healthy people and first healthy young people. So they're kind of like the canary in the coal mine to see if it has any negative effects. You can hopefully, if they're very obvious, find them quickly. And so he is one of the first people receiving one of the vaccines that the NIH is working on. And he's a person who's trained as a scientist. He volunteered because he kind of knows how clinical trials work, which everyone's now learning, I think, who isn't as aware of it. And his role is in some ways very simple. He raises his hands, he goes through a bunch of medical screenings, makes sure he's healthy, doesn't have any other risk factors, rolls up his sleeve, gets a shot, and then He is kind of monitoring for symptoms, comes back for blood draws to see whether his body is making an immune response to this virus. And they're going to be following him for more than a year. So that is kind of, these are the first kind of human guinea pigs in this, and they're going to be really important. But these trials can go a really long time. They're going to need thousands of people. So they're really going to need people to step up and volunteer.
Vera wrote into us from Los Angeles and asked, if someone developed antibodies, would you still need a vaccine? What do we know, Carolyn?
That's a good question. They are still trying to understand the immunity in general. So when you recover from the coronavirus, like many people develop antibodies, but maybe not everybody. And they don't yet know how long that immunity might last, how complete that immunity might be. And those questions are pretty much out there, but they're also unsure, with these vaccines, they don't know yet whether they work. So there's a lot of unanswered questions there. I do think when a vaccine does become available, they're going to prioritize it to people in really high risk groups. So you're talking about like healthcare workers who are going to be exposed repeatedly to this virus and therefore at risk, people with chronic conditions or elderly people. So it isn't going to be the whole world lines up on day one and gets the vaccine. It'll be a staggered rollout, potentially over years, honestly, because there aren't going to be enough doses. There's probably going to be, there could even be vaccines for different groups of people, ones that are targeted maybe for older people, because their immune response can be a little different, ones that are for people with younger people. We're just going to have to see what happens.
Here's another question. Vaughn writes in from Vancouver, BC, and wants to know, are scientists working on a cure as opposed to a vaccine?
Well, people don't use the word cure that much. They use treatment, and they certainly are. You probably have on this show featured, and we've all been watching some very exciting drugs that have been tried. I mean, there's also more than, there's also hundreds of trials of treatments going on at the same time as vaccines. A treatment could be potentially a shorter term way to help people and would be really, really important too. But that also takes time. So, gosh, time is compressed, but last week, I think the FDA made available this drug remdesivir, which in severely hospitalized patients is able to reduce the length of hospitalization. It was not, it's certainly not a cure, but those are the kinds of treatments that people are kind of working on. And, there's always a hope that the next one will be even more effective, or they'll figure out how to target it better to people to have a better effect.
So the Trump administration is calling its push to get a vaccine Operation Warp Speed. And the idea is to get production happening quickly, distribution, figure out who would get it. But Carolyn, what comes with that? I mean, is there, besides a cool name, what comes with the federal government's push right now to try to see this happen?
Well, the federal government is working on many levels toward a vaccine. They have not given that many details about this Operation Warp Speed effort and exactly how it's going to work. But what they've already been doing is convening people who are vaccine experts, the companies, a lot of like biomedical, infectious disease kind of people, and just trying to prioritize and think about the problems. They have at least weekly phone calls with like the key members where they discuss, things. And that's kind of just one area. They've also been sinking a lot of money into certain companies to try and help them get through the kind of development process. And a lot of the companies, I mean, it's so unusual. Usually companies they're risk averse because, they're trying to, make money as companies. But in this case, a lot of them are doing things that are pretty risky. Like they're already thinking about how to start producing their vaccine in mass quantities, even though they have like no idea if it's going to work yet. So the risk there is like a year from now, you find out this doesn't work that well, or it has a safety signal, and then you throw away 100 million doses or something. I mean, that would be really hard to do, but it's the kind of thing you do in a situation like this where you think it would actually be far more tragic to get approval for a vaccine on day one and have none to give the world, have to wait for a year really to get enough to give it to many people.
There have been concerns about antibody testing and quick approval of them, and the market being flooded with types that don't work. So are there lessons learned from that as the federal government thinks about its role in sort of green lighting vaccines? Like what questions does that raise for you as a reporter?
Yeah, I mean, ethicists are pretty worried about this. These two ethicists called this pandemic research exceptionalism, where you might lower the bar of evidence because the urgency is so great. It's kind of at this point in terms of vaccines very theoretical because we don't even know, how these late stage trials are going to be structured. But vaccines are usually held to the very highest bar of safety because they go into healthy people. It's not like a cancer treatment where you accept a level of risk because you have a very serious disease. So they're usually held to a very high standard. The FDA has been, and the vaccine scientists have been firm that they're not going to really lower that bar, but you are going to have to compress things in ways that haven't been done before. And so there is just, a kind of uncertainty about like how exactly we're going to even approve these. Some people have speculated, oh, maybe we don't even like formally approve them. We make them available under like an emergency use thing to a very selected population. It's so different than the normal situation. But typical vaccine trials can have like 30,000 people in them over years, and we're not talking about that here.
Wow. Finally, Carolyn, private industry versus nations. Like, how does it work for like a country's scientists to be working on something instead of a company like Pfizer? You were just reporting this week on Pfizer's efforts to work towards a vaccine. Is there a difference?
Well, they're working together. The companies have the scale and the experience to really bring products to market in ways that the government usually has not done. So it's not to say it can't be done, but what you're seeing is a lot of partnerships. So the NIH is the Federal Biomedical Funding Agency, but they have partnered with a Boston biotech company called Moderna. That is a partnership because Moderna has the platform, they're manufacturing it, and then the NIH is bringing a lot of their infectious disease expertise and they're running the trial. So there's a lot of that kind of collaboration that's going on because you're bringing together the companies that are good at making the products and then the governments that are going to probably like be helping with this process. But we're not even sure, but like, the government could in some scenario stockpile a vaccine before it's approved by buying a lot of it and then have it ready to go once it's approved.
Yeah. Carolyn Johnson, thank you so much for talking with us and explaining all of this. We're going to keep watching your reporting on the hunt for a vaccine. Just a fascinating moment to be reporting on that story. Everyone stay with us. We're going to talk about retail next. You might have seen that J. Crew has filed for bankruptcy. We'll look into what all that means coming up.
These days, it's anything but business as usual. That's why working together is more important than ever. AT&T is committed to keeping you connected so you can keep your patients cared for, your customers served, your students inspired, and your employees closer than ever. Our network is resilient. Our people are strong. Our job is to keep your business connected. It's what we've always done. It's what we'll always do.
Abba Badarai is my guest, retail industry reporter, and you have been very busy tracking the story of what coronavirus is meaning to the retail industry. Abba, thank you so much for talking with us. I want to start with J. Crew because that was the headline that greeted so many of us as the week started yesterday morning. A retailer beloved by many announcing it's filing for bankruptcy. What happened and what does that mean? Oh, I think you're muted, so just unmute yourself there. Let's see. Okay, try now. Let's try one more time. I'm still having some trouble hearing you, so we're just gonna problem solve this briefly, but stay with us. Hold on a second. We're going to bring Abba back in just a moment and get her on telephonically, like the old-fashioned way, basically. But we'll talk to her about J. Crew. She also has a story just published this afternoon about Starbucks. It's planning to reopen 85% of its American coffee shops by the end of this week. And the goal is to focus on mobile ordering and contactless pickup, no paying with cash, so that you could place your order ahead of time, go in and pick it up, just like people are doing at some local restaurants. So that's one of the stories she's following to see how that's going to change Starbucks and their future. She also did this amazing story with the help of our graphics design colleagues, looking at the layout of a mall and just what retail outlets may survive and may not survive coronavirus, and looking at everything from apparel to restaurants to specialty retail, and just how those locales are being affected. And if you go to the story, which I'll post on Twitter under my Twitter handle @LibCasey, you'll see the graphic of the old school mall layout and which of those retail industries are much more in danger now and much more of concern. The most vulnerable companies she reported on are companies that have a lot of debt and don't have a lot of cash. J. Crew was one of the ones that she was hearing warnings about by experts. Also, Neiman Marcus is one. Other categories that Abba reported are at risk are mall-based department stores, places like Macy's and J.C. Penney's. So these are question marks as to how they will be able to get through this. Now, Macy's has reopened dozens of department stores just this week. So it's not just Starbucks, it's also companies like Macy's that are trying to figure out a footprint forward. Macy's, of course, is different than Starbucks. You can place an order online for a beverage and walk in without paying cash, but Macy's is going to have to figure out how they do retail when the customers are used to going into a store, enjoying interacting with a salesperson, trying on clothes and figuring stuff out. There's so much personal interaction there and handling of garments. So we're watching to see how these retailers can develop new models and change. There's been a lot of furloughing of employees, as you know. There's been some layoffs. And then there are the questions of just what bankruptcy means and how a bankruptcy could actually function and work. Can a retailer make it through a bankruptcy and sort of revitalize in some way? Abba, I'm going to see if I can talk to you now. Can you hear me?
I can.
Thank you so much for troubleshooting this with us. We're gonna just have you on the phone with us. It's like the old-fashioned way. And I want you to start by talking about J. Crew, because this was something that you were warning about and sort of telegraphing could happen to retailers like J. Crew. But what was the decision to declare bankruptcy, and what does that mean?
Absolutely. Well, it's no secret that retailers have been struggling for years. A lot of them have been closing stores. They have huge, unsurmountable piles of debt, and they were barely hanging on, when times were good. People were spending and the economy was bumping. But the coronavirus pandemic has totally put a stop to that. I mean, within a week, we saw basically every retailer in the country shut down their stores, with the exception of, some grocers and hardware stores and things like that. So that means their sales basically went to zero. These were companies that were really cash strapped to begin with. They could barely sort of make ends meet month to month because they had such huge debt payments. And so this drop off in sales kind of left them in this very uncomfortable place. And we're seeing all sorts of retailers that were already struggling, J.Crew being the first one, that are starting to sort of look to what's next. And for a big number of them, it seems bankruptcy is where they're headed.
What does it mean when they declare bankruptcy? I mean, it may sound like a simple question, but is there any way that a company like that can rise from the ashes after having declared bankruptcy?
Absolutely. And, we've seen dozens and dozens of big name retailers file for bankruptcy in recent years. A lot of them still have stores. Some of them have disappeared. But in J.Crew's case, they're going to keep all of their stores, they've said, at least for now. They're going to keep operating things normally. They're just kind of rearranging some debt obligations. They're taking a look at sort of, their leases, pulling out of maybe less favorable malls or stores that aren't doing as well, but they're really hoping to, keep things going. And it's not a brand that's likely to disappear anytime soon.
You did this fascinating look at brands that could disappear or could really struggle because of the coronavirus. I just tweeted it out because it has this incredible graphic of like the mall floor plan that we're all used to seeing when you go into a mall and try to figure out what store you're going to. What are the companies that are in danger? What's sort of the type or the profile of a company that's especially at risk right now?
So the big ones that are at risk are department stores. They've been struggling for a very long time because people just aren't interested anymore. They don't want to go to the shopping mall. They're not looking for these mega stores with 500 different brands. They just want something very quick and easy. They're going to direct-to-consumer brands and specialty shops. And so companies like Neiman Marcus, Belk, JCPenney keep coming up on lists of companies that might be filing for bankruptcy any day now. And even sort of the more successful department stores like Macy's and Nordstrom are struggling. I mean, they're all kind of in this very uncertain territory, not knowing what to do. Macy's has started reopening some of its stores yesterday, but they look very different and they feel very different than what a Macy's might have felt like a couple of months ago.
Yeah, I mean, like, how are retailers talking about what it means to reopen? I was talking about Macy's while we were connecting with you, and this question of just what it means to go into a retail store if you don't have that same, personal interaction, if you're concerned about social distancing.
Absolutely. I mean, a lot of these retailers are trying to figure it out. They don't know. I'm hearing from a lot of companies that say, they've stopped paying their rent in the last month. They've sort of canceled orders. They've run out of inventory, or they're sort of like, left with tons of old winter stuff and no spring stuff. So they're all scrambling to get that in order before they can reopen and pay their vendors and whatever else. But for consumers, we're talking about a completely different shopping experience, much more curbside pickup, much more sort of buy online and, have a contactless experience once you get there. And Macy's is really interesting because they've sort of announced a bunch of new rules for consumers that come into their stores. And that includes you can no longer try on dress shirts. Anything else that you try on in the fitting room, the clothing will be quarantined for 24 hours before they put it back out in the store. You have to wear hand sanitizer before trying on a watch. I mean, there's just all of these new steps that we would have never seen a few months ago. And, everybody's wearing masks. Everyone's being encouraged to wear gloves and stay apart from each other. So it's a very different post-pandemic era.
You reported on this conundrum of wanting to support businesses, local businesses or otherwise. And yet when a business is functioning, employees have to work. Okay, good that they get paid, but treacherous in that they might be putting their lives at risk. And you did this fascinating story, Abba, about online retailers trying to fulfill orders for goods that are decidedly non-essential. But their workers were still at work trying to, get people deeply discounted packages of a nice jacket or a nice sweater or something like that. What's the conundrum facing workers and retailers as they try to strike a balance between keeping things moving but keeping people safe?
That's a great question. And I think in the past few weeks, we've heard a lot about essential retailers versus not, or essential workers versus not. And these online sort of behind the scenes warehouse workers really fall into a gray area. They're being allowed to keep working, even if they work for a non-essential retailer, like a makeup company, say, or like, a designer handbag company or a department store. They're still going to work. Sometimes they're fulfilling orders from a store at the mall that's closed to customers. But they're all kind of grappling with these questions of perhaps not having enough protective gear, not being able to stay 6 feet apart from their colleagues, and worrying about sort of the risks that they're putting themselves in to fulfill orders that seem completely frivolous to them. And on the flip side, you have people who are furloughed or who are staying at home, working from home right now with a bunch of free time on their hands. They can't go to the mall to pick up what they need. And so a lot of brands are seeing an uptick in online sales because people are like, well, I could order a new set of pajamas and have it delivered straight to my door. But the workers on the other side of that are really paying the price, they say.
So are companies asking questions of what their responsibility is for making sure that those workers have the proper protective gear or are working at a safe distance from each other? We've been seeing motions by Republican Majority Leader Mitch McConnell in the Senate to want to protect companies, and protect them against lawsuits and such. But what's the conversation about making sure workers are okay and that the companies are protecting both their own interest and their worker interest?
Companies are starting to move in that direction, but the thing that I keep hearing from workers is that they feel like it's too little, too late. It is something, this is a completely new situation that companies and workers are navigating. And so I think there's just a lot of uncertainty. And even when companies have good intentions and they say they want to provide masks and gloves for all of their workers and, make sure they have enough to sort of cycle through a new mask every few hours, they're having trouble getting those items. So we're running into a lot of issues that way, where workers are saying, yeah, the company is providing masks and gloves, but I only get one per shift. And sometimes my shift is 12 or 13 hours.
And what about companies that rely on consignment goods? That was such an interesting question you were writing about, because they're not just dealing with, items that might have been minimally touched, by people in a couple of weeks or, along sort of an assembly line. But if you're working on consignment or you're taking in goods that have already been used by people, by nature, they're going to have, gone through so many people's hands already.
Absolutely. And that's another murky area. There isn't a whole lot of data about how long, the virus could live on clothes or live on a tissue sort of in the pocket of a pair of jeans or something that somebody might come in contact with. But one of the workers that I spoke to worked for a warehouse of the Real Real, which is an online luxury consignment store. And they said that they're dealing with just tons of shipments. People are sitting at home. Again, they're cleaning out their closets and saying, hey, if I can get a few bucks for this pair of jeans, let's try it. So they're going through more inventory than usual, and they're kind of worried because a lot of it is used, a lot of it, or some of it is sometimes dirty, and there are just a lot of unanswered questions about what's safe and what's not.
So your latest story is about Starbucks pledging to try to reopen a lot of its stores. What are the protocols going to be? What are the calculations Starbucks is making?
So Starbucks is moving to open 85% of its stores by the end of this week, which is almost 7,000 stores around the country. And this is the first major push by a national retailer to reopen right now. And what they're saying is that it's going to look completely different. I mean, a lot of people were already using the Starbucks mobile app to place orders and pay, and we're going to see a huge push towards that in the coming days. A lot of it is going to be, placing your order beforehand, curbside pickup, perhaps delivery, and they're looking for cashless options, so you can pay on your mobile app versus having to actually exchange money.
What are you watching, Abba, for as companies try to figure out a new normal and ways to stay afloat? Like, are you watching to see how things go at Starbucks, both in terms of the economic model as well as customers' interests? Like, what are the smart questions you're asking?
Yeah, I think the big sort of unanswered question here is whether the consumers will come back. Retailers can open up their stores, malls can reopen, but are people willing, either because of health reasons or safety concerns, or because they just don't feel like they're in a position where they can spend $3 or $4 on a cup of coffee. Millions of Americans have lost their jobs. Many more are worried that they might lose their job in the coming months. And so, there's the big question of demand. Do people want to go to the mall right now?
And then finally, even if a company like Starbucks reopens a lot of its locations, it won't necessarily have everyone back at work, right? Because if demand isn't quite built up, or if they're trying to practice some social distancing models in their stores, how are they dealing with their employees?
That's a great question. And that's something that I hear from, a bunch of confused workers, and companies are sort of trying to navigate this gray space as well. A lot of companies have furloughed their workers. In some cases, they laid them off completely. And now they're trying to figure out who's willing to come back, who's available to come back, and sort of what that new staffing model might look like. So I think that's something that we're really going to see play out in the next few days.
Great. Well, of course, as those workers also weigh unemployment benefits, if they're able to receive them, if they've managed to get through where they live, and then weighing unemployment versus the job. So a lot of good questions you're asking. Abba, thank you so much for joining us, and thank you for being so resilient and connecting with us. We're so glad to get to talk with you.
Thanks so much for having me.
Yeah, Abba Badarai, retail industry reporter, and you could read all of her work. I did tweet out a link to that story about the mall, because they take the model of the mall and they show you which stores might be in danger, what they're watching in terms of retail. And it was a fascinating look at just what the future of America's economy may look like. I'm Libby Casey, and I thank you so much for joining us for this past hour. We will be back on Thursday at 3 o'clock, and we look forward to joining you then for another special report from the Washington Post. Stay well.